Hello, my name is Anne Winfrey, and I'll be talking about the medication gabapentin, which is also called Neurontin. It's an anti-seizure medication, and it's also used for the treatment of neuropathic pain. Today, I'll be talking about the uses of this medication, some history of this medication, the mechanism of action, that's how it works, the side effects. I'll be talking about some medication counseling and, of course, my references. Some history about this medication. It was developed by Parke Davis in 1975. Parke Davis is a subsidiary of Pfizer, a pharmaceutical company. And this medication was approved in 1993 in the UK for the treatment of seizures. And in 1994, the US Department of Food and Drug Administration approved it for use in adults, and that use was extended to pediatrics in the year 2000. This medication was the most prescribed medication in the year 2016. That's why it's called a wonder drug, because of its off-label uses. So under the uses, I'll be talking about the FDA approved uses. There's the off-label uses, and I'll be mentioning how this medication actually works. So under the FDA uses, it's basically used for treatment of partial seizures, and it's usually used as an adjunct treatment. It's also used in post-herpetic neuralgia. This is basically the pain that's associated with shingles, as you can see here. So this medication is known to help with these conditions. The non-FDA uses, that's same thing as the off-label uses, include the treatment of diabetic peripheral neuropathy. Is used for the treatment of fibromyalgia, for pruritus as associated with hemodialysis. It's also used by menopausal patients for treatment of hot sweats. It's used for acute post-operative pain, used for tremors in multiple sclerosis, for migraine headaches, for prophylaxis, and it's also used for treatment of nystagmus. Here I'm going to talk about the mechanism of action. So gabapentin works basically in the brain, so the part of the brain that's called the hippocampus and the neocortex. It has a sedative and an anti-seizure effect. It helps with the relaxation of skeletal muscles, so it helps in spasticity and helps with neural pain as well. It's usually taken by mouth, and it's absorbed in the intestines. It can be taken with or without food. It doesn't really matter. It is excreted mainly through urine. So that means that we have to make sure that your kidneys are functioning well to be able to take this medication. The dosage is usually reduced in the elderly, because the elderly population usually have a reduced kidney function. Now I'll be talking about some of the side effects. So there's drowsiness. It causes a lot of drowsiness, some confusion, dizziness, some fatigue. So it comes with unsteady gait, of course, when you're dizzy. In some people, you can see some aggressive behavior. There could be some increase in suicide thoughts. It causes hypotension, and there's usually peripheral edema, that's a swelling of the extremities. There's also some dry mouth. People have complaint of dry mouth, blurry vision, double vision sometimes, constipation. Weight gain is a big one. There's nausea, vomiting. Of course, there's pruritus, and especially Stevens-Johnson syndrome. which I have a picture of on here. It's a side effect that should be watched with this medication. Some of the precautions that comes with taking this medication is for those who are pregnant or planning to become pregnant or who are breastfeeding. They should let their doctor know because this medication is considered a category C medication for people who are pregnant and breastfeeding. So you have to let your doctor know so that they will reduce the dosage. Also, for older adults have low kidney function, so it's usually the dosage is usually reduced. It's not the older adults don't usually get the full dosage that the younger adults usually get. Of course, the renal disease, those who have kidney diseases, and those who are on dialysis and hemodialysis, and patients who are depressed, because this can increase suicidal thoughts. Okay, here I'm going to talk about the interactions of this medication with other medications. So when you take this medication with alcohol or other sedatives, it will increase the effects of this medication, especially the sedative effects, which you do not want. If this medication is taken with morphine, that's the oral morphine, it increases the absorption of this medication in the intestine, because morphine will usually reduce peristalsis, that is the movement in the intestines, and this will cause more of this medication to be absorbed, and that you do not want because of the sedative effects that comes with this medication. Also, the effect of this medication is decreased when it's taken with antacids. So usually patients are advised to take this medication 2 hours after taking an antacid. There's also decreased effect of this medication when it's taken with hydrocodone, another pain medication. And of course, the effect is increased with herbal supplements like kava, chamomile, there's herbs, valerian. These medications, which are usually like over-the-counter medications, you should let your doctor know that you're taking these medications, so that would help determine the dosage of this medication. This medication is contraindicated in people who find out that they're hypersensitive to the products of this medication, like skin breakouts. Also, for patients who have severe kidney failure, this medication is contraindicated for these patients. Okay, some things that patients have to know regarding this medication: to report new or worsening depression or increased suicidal thoughts, because this medication is known to cause increased suicidal thoughts. If there are any changes in behavior like aggressiveness, you should let your doctor know. Patients should avoid any activities that require mental alertness because of the drowsiness that this medication causes. Patients should report any swelling to their hands and feet or face. This medication cannot be stopped abruptly because it may cause seizures, so you should let the doctor know if you don't want to take medication anymore, so that it can be tapered over the course of a week. You should report any skin rashes, especially the Stevenson's Jones syndrome, because it's a very serious side effect of this medication. This medication should also be swallowed whole. If the tablet is cord, you can take the other half the next dose, and you cannot drink alcohol when you're taking this medication. Patients should also have a medication alert on them, so that if just in case of any overdose, so that the providers can know exactly what the patient is taking and be able to help the patient out. All right, here are my references. Thank you very much. Thank you.